think transforming the treatment landscape, I think it's a bit early for that. There are definitely some interesting lines of inquiry. They could probably be divided into two. So one is better delivery of existing agents, and in that area I think one drug that's worth mentioning is ASTX727, Incovi is the brand name from Aztecs. This drug is now FDA approved for MDS and CMML. This is an oral hypomethylating agent. It allows for Decitabine to be given orally. Why I think this is important is that one of the drawbacks of hypomethylating agent therapy, particularly for this patient group, is difficulty of delivery and the need for parenteral treatment. And I think the ability to give these drugs orally will be transformative to the quality of life of these patients. And this is a drug that we're taking forward in a clinical trial in the UK. It's not currently available in the UK, but we're about to open the AMO trial, which is going to have a variety of endpoints and research objectives alongside. And this is going to expand the group of patients receiving this drug to the whole gamut of MDS-MPN overlaps, not just CMML. And we're quite excited to open. This will be the first CMML focused clinical trial in the UK for some years. Other novel agents, unfortunately in CMML, a lot of the targets for the new wave of targeted therapies, the IDH1s, IDH2, FLT3, they're quite rare mutations in CMML. The mutations that we do see in CMML are not conventionally targetable. There are a few interesting lines of inquiry. There are trials looking at Ruxolitinib. There are trials looking at GM-CSF inhibition. There's a drug called lenzilumab that has completed phase 1 trial. Seems to be safe and well tolerated. Conceptually as well, I think targeting splicing is really interesting. There's a lot of groups around the world trying some really clever and innovative things at trying to target splicing, which is a fundamental process that is dysregulated in CMML. Unfortunately, the phase 1 data for H3B8800, which there was a lot of hope for, didn't show compelling evidence of efficacy. But I think there are a number of other strategies coming along for that. There is a strong premise also for targeting MAP kinase signaling, so the RAS pathway, and obviously this is the case in a lot of cancers. People have tried targeting farnesyl transferase. People have tried. There's a drug called Ruxolitinib that unfortunately didn't meet its endpoints in the trials, but people have tried targeting MEK. I think we're also at the stage of trying to target ERK. There is a wave of new ERK inhibitors, and I think these have a really strong premise for use, particularly in proliferative CMML.